but this is something that we're not taught in pharmacy school. We're not taught the value of our network, the value of maintaining your name, your reputation, your personal brand. That's how you got into something, is you maintain the HJ Hayes brand. Welcome back to the Pharmacy Rockstar podcast, where we rock out in the world of pharmacy excellence. Get ready to be rocked by industry leaders as we dive into the world of pharmacy business, best practices, trends, and entertainment. I'm your host, Dr. Steve Rodriguez, pharmacist, certified mergers and acquisition advisor, and lifelong rock enthusiast. A huge thank you to each and every one of you for joining us today. Please leave a comment, rock that like button, and subscribe to our channel for more exciting content. Today's guest is a pharmacy rock star that practices in a very unique setting. He received his Pharmd from South Carolina College of Pharmacy. He has experience as a specialty pharmacy director working in various pharmacy settings and maintaining URAC and ACH accreditations. He is licensed to practice pharmacy in the states of North Carolina, South Carolina, Virginia, and Tennessee. He currently practices as a clinical pharmacist specializing in alcohol and drug abuse treatment. Ladies and gentlemen, please welcome to the Pharmacy Rockstar podcast, Dr. HJ Hayes.
Oh, that was a good introduction. I'm like, what are you talking about?
Heck yeah, man. Welcome to the podcast. How you doing, bud?
Good, man. Thanks for having me. Excited to be here.
No, man. Hell yeah. Let's go. Well, man, so tell me about yourself, HJ. I mean, what's your story? What do you do? Tell the audience about yourself.
Yeah, so my story, I am from Manning, South Carolina. Not the biggest place, but very proud, born and raised Manning, South Carolina. Left there, went to Clemson for undergrad, graduated from there, spent a couple of years as a medical laboratory scientist, where I kind of enjoy working in healthcare, work like in the hospital setting, but really was like, I want to see people or just have a little more direct impact with the people that I'm helping. And so, cause I worked in chemistry primarily. So I'm the person that like got the tubes of blood when you came to the ER or were in the hospital. I got the tubes of blood, spun them down, ran the test on them. Sometimes I got other bodily fluids too, other bodily samples that I won't mention here, but did it all and still actually certified in that field also. But so did that for 2 years full time. But in that time, I started looking at careers and the pharmacy was where it was at. I get bored quick. I'm like, like this has been fun, but I want to try something different. And so I had a few friends, ironically. One was in pharmacy school and a couple were pharmacists, and they all did something completely different. But all had the same degree. And I'm like, that's it. Like, that's the profession for me. Because I know that, as I become a pharmacist, I can see all these different things in all these completely different areas. And so I started pharmacy school at University of South Carolina, which at the time it was called South Carolina College of Pharmacy at USC. So went there. So I went from being a Clemson Tiger to becoming a Gamecock for a little while, but still go Tigers. I'm certainly proud of the Gamecocks, especially the women's basketball team. They did great this year. So I did pharmacy school there, and then I left there, did a community residency in North Carolina, and that's how I kind of got the independent pharmacy bug, which was a great learning experience for me. And I ended up staying on with that pharmacy for a few years that I worked at, and that was my residency site.
You did a residency at an independent pharmacy?
Mm-hmm. Yep, it was through UNC Chapel Hill, at a pharmacy called Moose Pharmacy, in Concord, North Carolina, or based out of Concord, but kind of near Charlotte. And then yes, I worked and I ended up working there for a few years, and I got the professor bug. And so I was professor for about a year and a half. And then I became a specialty pharmacist, and that was my first director role. And so that was a lot of fun, definitely a lot of work. Kind of that pharmacy. The pharmacy, I think, hadn't been quite active for maybe like not quite a year when I got there, so it was still new. Had to work on increasing the script count. I had to get licensed in some other states. I learned how to, build a staff and just build a team and, build a pharmacy, how to, really leverage my personality with business and kind of, and it just help grow it. So it was fun to do. And I did that until November of last year. And then I found out about an opportunity to work in substance abuse, alcohol and drug abuse, which is where I work now. And so it's pretty cool. Working in this space because I'm, learning a lot. I get a little bit of inpatient pharmacy, which I have not had in my career to date. So this is my outside of rotations in pharmacy school. I'm kind of like working in technically a hospital setting. It's very unique. And yeah, it's been a joy to kind of just, learn a different side of myself. I'm having to use a part of my brain. I feel it's a little more clinical and a lot more just kind of like seeing what each patient needs.
Yeah, no, that's awesome. As I listen to your story, I'm like, man, you sound like me. I mean, no offense, man, but you're a pharmacy nerd, man. I mean, we just are. I mean, I'm like, you're describing yourself. I'm like, man, this guy sounds like me. I mean, we're just pharmacy nerds.
Now I'm goofy now. I love. So side note, when I left my job in Charlotte, they brought me a Comedy Zone class. I'm a graduate of the Charlotte Comedy Zone as well. So I did a little bit of stand up here and there when I had
Yeah,
time. I
yeah.
haven't done it in a while. But I'm working on that too. I'm working
Oh,
on
that's
kind of
awesome,
getting
man.
back
That
into
rocks,
that.
man. That
But
rocks.
yeah, I'm a big goofball. Like I said, I
Yeah.
honestly, to be honest, the shock of the day, whenever I got the invite, I'm like, what is this? Who are these people? About I'm like Rockstar. I'm like,
That's
dang,
right. Heck
like,
yeah, man. Yeah.
what?
Heck yeah. Yeah.
But like I said, so I don't take my as nerdy as I am. Sometimes when I go I call when I go off on my tangents about like, oh, this is that third. And people, and some people have been like, oh, like you're such a serious guy. And then they actually get to know me. They're like, you're the goofiest bro I ever met in my life.
Yeah.
I'm just like,
Right.
yeah,
Right.
it's
Heck
how
yeah. Yeah, we are. Yeah,
like
we are, man.
I'm baseline goofy, but yeah, you're right. I'm a pharmacy nerd. I really enjoy. My nickname in kindergarten was Curious George. My teacher was like, all I asked was why, but why this and why that, and so that's something that stuck with me. And shout out to my parents. They always encourage. Even though I'm sure it probably got a little taxing, they always encourage it. And and when they didn't know the answers, they would try to like help me figure them out or find someone who knew it. So
Yeah, yeah. You talked about being in a hospital setting. See, I still practice as a hospital pharmacist. I'm a former pharmacy owner, and I love independent pharmacy. I love retail pharmacy with my patients. But my true passion is hospital pharmacy. Like as practicing as a pharmacist in a hospital setting because it's that nerd in me. I love the vancomycin dosing. The trough dosing. The pharmacokinetics and just infectious diseases. I mean, that's where, man, you start talking like that, man. I start nerding out. I start getting because that's what I really like to do as hospital pharmacy. I mean, I love business. I love. I'm a pharmacy broker and I help other pharmacy owners buy and sell pharmacies. I help people get into pharmacy. I love that. That's what I do. But practicing pharmacy, man, I really love practicing hospital pharmacy. I mean, to me that was my first real pharmacist job when I was in pharmacy school. And so I got exposed to a lot of inpatient hospital stuff, and I really, really loved it, man. And I was really set to go that way. I was set to do the hospital route, do the residency thing, and become a director and work all that. But last rotation of the year, I ended up. I was working at an independent. My last rotation was with an independent pharmacist, and him and my boss at the time, they knew. They said, "Steve, look, you want to have your own pharmacy someday, so why don't you just skip the residency? You know what? Stay with us. We'll show you the ropes, and you go open up your own store." And that's exactly what I did. You know, but truth be told, man, I tell you, I love that inpatient, hospital pharmacy, man. It's a lot of fun.
oh yeah, I find my the all I haven't really had a horrible job. I've been really lucky in that regard. It's been 10 years as a pharmacist now. So I've looked up in all my positions. And I've worked with some great people. So this my newest venture is no different. Good love. I absolutely love adore my coworkers, and so it's a pleasure to go there every day.
No, that's awesome. That's awesome because there's so many. Unfortunately, there's so many pharmacists that can't say that. They have a job. Where the stress levels are very, very high. They're very dissatisfied, and that's very, very unfortunate. So let me ask you. So what do you do as an alcohol and drug abuse treatment clinical pharmacist? I mean, like, what does that entail? What do you do? That sounds very, very interesting to me.
Yeah, so in our setting right now, so what we basically do is, we're the people that, when orders are prescribed for patients by the prescribers, that by the providers, we're the people that we review the orders to make sure that, make sense with the patient's diagnosis, to make sure that, we're not giving any, for lack of better words, like toxic combinations, to make sure that, doing our jobs as pharmacists, checking to make sure that even down to like we have different protocols, so just make sure the links of the protocols are appropriate. Hey, do you really mean to do this for 6 days? Do we want to do this for three? Or hey, this patient has this disease state and on this drug as a result, we can't give, phenobarb. We need to, maybe try benzo, things like that. So it's a lot of it's a clinical side of my brain that, I of course use it all the time as a pharmacist, but in an inpatient setting where it's like way more acute and people are there and, going through detox or things like that is like really like you got to be like on top of it.
So is it dealing with like a lot of the DTs, like DT, protocols and?
Yeah, we have people in different stages. We have the acute uh part of the hospital, and then we had the people that have kind of gone through detox and is more so they're kind of going to different dorms to start like really like the recovery process. Like once they're going through detox, it's like, okay, what's next? So in addition to the medications they get counseling, they get therapy. They have a community involvement where they have caseworkers who are on site with them to start talking about, okay, like what are the next steps? And for some of them, the next steps may be, maybe to go back home, depending on, or sometimes the next steps are, to go to another facility to stay like for another extended period of time. So it's kind of depends. Right now, as a part of the pharmacy team, what we're working on is assessing the patient needs to see how we can educate them what pharmacists can do for them outside the facility. They're familiar with what we do inpatient. Like I said, we're the ones that are keeping basically the drug protocol safe. But outside the facility, realize there's a need when people, leave the facility. Sometimes they don't realize what a pharmacist can do. If adherence to drugs is an issue, and we can say, hey, there maybe this pharmacy that does pill packs. Maybe charge a small fee for it, but you can get pill packs if your issue has maybe been remembered to take certain medications that kind of help you stay sober. Then we can give you can watch Child's Pharmacy has pill packs. So just things like that. That's what we're working now to kind of like expand pharmacy services to give a little more education. But also in giving education, start really assessing, okay, what are some additional needs? What are more things that pharmacy can be doing? Any role I've been in as a pharmacist, it's always been important to me that whoever I'm working with. Is understood, especially in an environment like this where, it's not just a pharmacy, it's a whole hospital. We are multidisciplinary, that, that we understand, like, that, we want pharmacy to have a seat at the table, and let's see what pharmacy, how we can be involved in the grand picture. We don't just want to be siloed into, one thing. So any role I've ever had, it's always been about just expanding the practice of pharmacy, expanding, showing people what pharmacists are capable of. And so like I said, I'm just team pharmacy. So I'm a pharmacy nerd because I believe in everything pharmacists can do. And so in this role, in addition to, like I said, the drugs, we're working on like some education things now, which is it's been really fun developing some of the materials and going to be working with the patients soon. So that's gonna be a lot of fun.
Yeah, no, that's awesome, man. That's awesome. So yeah, I think after COVID, it really expanded the role of what pharmacists can do and what we're capable of doing. I mean, I was on the front lines, during COVID, and man, I mean, there was a lot that was going on, and it really, I think it created an opportunity for pharmacists. Those guys that were willing to get out there and weren't afraid, because let's just be honest. I mean, pharmacists are the most accessible healthcare provider in the healthcare system,
Yeah.
and during COVID, pharmacies didn't shut down. We
No.
got slammed. It was.
I heard that a lot in school. But like I tell, young pharmacists or, pharmacy students or people aspiring to be pharmacists, like that line right there about us being the most successful healthcare professional, like, own that thing. It's serious. Be prepared for it. You can go to a party and someone finds out you're a pharmacist, you're gonna get pulled aside and say, hey,
Oh,
I have this
absolutely.
question.
Oh,
I don't
absolutely,
mind
man.
it. I answer what I can, I
Yeah.
do what I can.
Right.
especially for people that I know may be like underprivileged, underserved. But I mean, you got to really own that thing because it's
No,
true. We
absolutely,
are
man. No,
the
absolutely.
most successful
Absolutely.
healthcare professionals. Yeah, we're the most approachable. I feel lots of times we're super approachable. And so yeah, I totally agree with that.
Well, hey, well, I mean, well, I just really think this alcohol and drug abuse treatment thing is so unique. I mean, how did you go about, getting into that, like specializing in that? Like, how does a pharmacist that wants to specialize in a role like that, you know, like if I got a pharmacy student, that's watching the show and they say, hey, that sounds really interesting. I want to pursue something like that. How would they go about that?
All right, so we can cut right here. Hey, we can cut right here. And then just because I think there may be like advanced trainings and things like that. Those I'm not familiar with. For me, it was just more so like a connections. And I say that just really I interviewed for the job. And so I mean I guess I still interviewed against other people. But yes, I'm sure there is specialized training. I haven't really looked that up. But for me, I've had a background in community, a background in management. And so I guess it's what made me a candidate. So I'm not sure if I can answer that fully. That's why I was like,
Yeah,
let's
yeah,
cut
no,
just
no,
to
but you did,
yeah,
you
yeah.
did, you did, you did. And this is something that one of the things that this is why everybody needs to like, subscribe, comment on my channel because what you just hit on something, you don't realize what you hit on. But this is something that we're not taught in pharmacy school. We're not taught the value of our network, the value of maintaining your name, your reputation, your personal brand. That's how you got into something is you maintained the HJ Hayes brand. You kept yourself in a network. You stayed connected to the right people, and that's how these opportunities present themselves. That's something that we're not really taught in pharmacy school, and that's one of the things that I want my audience to know is that, man, hey, your network is your net worth. It really is. And that's something that you were doing. You didn't. It sounds like you didn't realize what you were doing, man. But you were doing that, man. You were maintaining those contacts. You were maintaining that network. And yeah, you did a residency, and you've got the credentials, and you did some other stuff. But that's how these doors open up. I've seen deals where, I've seen situations where pharmacists they assume that they can't do something for whatever reason. I don't know why. But they just think they can't do something.
Oh, gotcha. Yeah, that's definitely not me. Yeah, I'm like I can do anything. Not saying anything I want to do, but I'll give it a shot. I'm a trialic, so
Yeah, no, and there's nothing wrong with that, man. Yeah, go for broke. You have nothing to lose. So if you're unhappy in your career and you want to try something new, go for it, man. Make it happen. Just do it, man. And that's one thing that that's awesome to hear. People like you just thinking outside the box and going out and trying something new. Trying something new, and that's awesome. Just having the courage to do that. But again, going back to the importance of maintaining your network, maintaining those relationships, because so many, not just pharmacists, but I just think a lot of people in general, especially with social media, people will post stuff on social media, and they just say whatever's on their mind. It's like I think Mike Tyson said, not too long ago, the problem with social media is that it's made people. What did he say? He said something along the lines of, people will say stuff because they know they're not going to get punched in the face or something along those lines. Where people just say nasty, ugly things on social media, thinking that I can say this, but really you're damaging your network. You're damaging your brand. What you just did on social media, that makes you look bad. And if you think that there aren't employers, you think that there aren't colleagues, you think that there aren't other future opportunities that are seeing that, that's going to negatively impact you in the future. And I see that like on LinkedIn, I see people on LinkedIn, they'll make these comments and, they just go on and basically they're just looking to bash people and anytime they post something.
oh
And
gosh, yeah, yeah.
you know what I mean? And I'm like, really? You're on LinkedIn and all you're doing is trolling? That's really not going to get you anywhere. That's really going to
You're
hurt you
right.
down the road. I'm like, but yeah, no, that's just, those people obviously don't understand the importance of a network, So it's, obviously you do, and that's how you're able to get these unique positions, these unique roles where, you're putting yourself in the right position by doing the right things and just maintaining that network, man. So kudos to you for doing that.
Yeah, I could probably give a more put together answer to that question. I was like, well, let me just I just want to make sure I didn't know
Yeah,
if you really want to know, like, is there like a residency or certification?
yeah, yeah.
And there probably is. I don't have it.
Hmm.
But yeah, I can give a better answer to that question now that I know we can go in that direction. So
Yeah, yeah. No, man, you're good. No, you're good. Hey, well, let me ask you this. So the name of my podcast is the Pharmacy Rockstar Podcast. I'm a huge rock fan. I mean, and not just rock music. I mean, I love music in general, man. I love all kinds of music. I listen to, oh gosh, heavy metal, hair bands. I listen to alternative punk. Right now I'm wearing my Blink 182 shirt. But I grew up. My favorite R&B band was New Edition. Man, man, New Edition was like they're my, in my opinion, they're the greatest R&B band of all time. Just my opinion. I mean, I'll put them up against anybody. I'll put them up against Temptations, all of them. I just think they were the
oh
Jackson
man,
Five.
okay, that's
I mean,
oh
maybe the Jackson Five. Maybe the Jackson Five might be a little.
man, look at you stirring that pot now. I love
That'll be good. That'll be good. That'll be a good argument to have, right?
I mean, no, those are all greats. I don't know if
Yeah,
I can even add things to that. No, you
yeah,
named some Temptations, New Edition, Jackson
yeah,
Five.
yeah.
Yeah, man,
But the New
Steve ain't
Edition.
scared of nothing. That's what I'm talking
No,
about.
no, man, I get it all. I love all that. But but professionally speaking, what does it mean to you for whenever you hear someone called a rock star? Say that person's a rock star. What does that mean to you for someone to be called a rock star? Like, what do you think of?
Oh man, for me, I think it's a double-edged thing or a two-way street. Number one, clearly it means like you're at the top of your game. You are the greatest of the great. You're good at what you do. That's a big part to me. But for me, the second part of that is you treat people good. I'm all into feelings and compassion, and people don't remember like what's the saying? People don't necessarily remember like what you said is how they felt. How you treated them. And so I'm really big on connections and how people treat people. And it kind of being speaking what we are just talking about, I did pretty decent in pharmacy school, but I was never like top. I wasn't at the top of that class. Um, but a lot of doors that have been open for me, like I said, I'm competent, but a lot of doors that have been open for me has been like, hey, like, you're really solid guy, you were dependable, you showed up, nice person. And so those are the things that, are invaluable. So for me, like I said, Rockstar is someone at the top of the game and know what they're doing, but they know how to treat folks too. Because if you can't treat people right, I guarantee, you go all around and treat people the wrong way, it has a way to come back to get you. As I've been taught that, growing up, but the older I get, the truer I see it.
No, man, I totally agree, man. I totally agree. So so when you think of a rock star in business and work and life, who do you think of?
Several people come to mind. I don't know if I have just like one in particular, but like I said, that's what drove me to pharmacy. I can reinvent myself.
Like who? Like when you think of, it could be somebody, personally, somebody at your church, somebody at your work, some.
Yeah, so I'll go so far. So just as a whole, just this is a pharmacy podcast. One person that has inspired me tremendously was my original preceptor, Joe Moose, complete rock star. He just exudes excellence, and he just taught me a lot. I was lucky to kind of work under him, closely. But he has taught me so much, just by, and not even, of course, we keep in contact, but just watching him. And I think that's what a rock star is. You don't have to directly have a direct lesson. You can just watch how someone moves, over the years. And it's a certain level
Yeah, like what? Like what would Joe do? What made him a rock star in your mind? Like give us some examples of what.
yeah. So Joe was one of the first people that taught me, like, it doesn't have to be like by a blueprint. You can't follow this thing to the T. Especially coming out like the lab world where everything was like, hey, if this happens, do this. If this happens, do that. That's kind of like how I worked in the lab. Joe was the first person that taught me you don't have to have a map. Sometimes you gotta just go with it. When you're at a patient's home and, we do home visits and things like that at a patient's home, and they say something that may be like you have this script you may be trying to go by, adjusting or looking at the medications, and they say this one thing, and it might involve like, hey, forget the medications. I need to call a social worker, or I need to call someone to come look at this person, or this person has no family, they don't have any food. Who cares about getting them meds adjusted when there's no food? So Joe kind of taught us lessons like that. that you have to really look at the whole patient. He was big on that, looking at the whole patient. And so I've taken that, which is when I was a pharmacy director, looking at the whole business. In addition to hitting my metrics, are my people happy? Is my staff happy? With me, are they happy with what's going on here? If not, how can I possibly correct that? You can't correct everything, but you try your best. Looking at just relationships and just family and life, all that. It's like, okay, what's the whole picture here? So that's the one thing that Joe taught me, but as I watched him move over the years, and so that's one thing that just is constantly inspiring to me.
Yeah, no, that's nice. As you were talking about him, it kind of reminded me of whenever I owned my pharmacy before I sold it. I always had this saying that I would tell my staff, whenever I'd go on vacation and whenever I knew I was going to be away from the pharmacy for an extended period of time, I always told them, I said, look, always do what's in the patient's best interest. As long as you do that, you'll be fine. I said, you won't get in trouble by me. We won't get in trouble with the state board. You won't get in trouble with anybody. As long as you put the patient first and do what's in the patient's best interest, everything will be fine. And it sounds like that's what Mr. Joe kind of practiced as well. It kind of instilled in y'all. Is you put that patient first. You put that patient first, everything will work itself out no matter what.
Oh yeah. And I say he taught that, and being in when I kind of got into a director role myself, I lived that. I learned that too. During my time when I was director of pharmacy, I put patients first, even when sometimes it hurt or maybe it didn't make sense to some people. Of course, I stayed within the law. And the business only grew. That's all I can say is it grew. Sometimes, some days I know how I was like, this may not be the best of business, but this is for the patient, and it grew. So like I said, I've lived that thing. And so when you live it, no one can take it from you. No one can tell me otherwise.
Right. Oh, that's awesome,
yeah.
man. That's awesome. That's so awesome. What are some of the biggest challenges that you see in our profession as pharmacists and in the world of pharmacy? Like, what are some of the biggest challenges that you see?
So sometimes I think just inclusion, and we look at in the state of like multidisciplinary teams being included. Sometimes I think is one challenge. And people just not knowing the extent of the things we do. Lots of states now, in many cases, have pharmacists who act as like mid-level practitioners. So they are mid-level practitioners. A lot of people aren't aware of that. That pharmacists can do those things. We're prescribing in certain states now. We have different prescriptive authorities. So I think just people not knowing fully everything that we're capable of doing. And then sometimes people know that, but still kind of giving us that see at the table. So, those are probably the biggest challenges I see. Kind of leaning back into just my independent side. Of course, there are a lot of, different people trying to take back money and things of that sort. It makes it really hard sometimes to keep the doors open for some people. And as you mentioned earlier, some pharmacists are having to like close their doors and things like that because of, you have all these crazy audits sometimes and just all these things that want to, and I know they're working on fixing some of that, which is great to hear. But yeah, that's some of the issues that pharmacies are facing too. So those are the big things I can think of.
Yeah, no, absolutely. Yeah, no, reimbursements, right, always been an issue, and that's especially in the world of independent pharmacy, reimbursement with PBMs, those are some challenges for sure. So, going back to Mr. Moose, he would experience these challenges, I'm sure. Like, how would he navigate these things? Like guys that are rock stars that you've seen in the world of pharmacy, kind of how do they handle adversity and challenges?
A couple of ways. Joe, speak up about it. I know I recently saw a clip of him. He was like on Capitol Hill, speaking with people about the issues. So just speak up about it. Closed mouths don't get fed. And with Joe, like I said, it's not even all about the money. It's just about, being able to take care of people. So speaking up about it, and then, being innovative, finding, creative ways. It's like, okay, well, I can't get in the door that way. Well, let me try going in a different way. And just thinking outside the box. That's Joe, and those are things that Joe taught me. Like I said, when I had the ability, when I was running my own pharmacy, or not my own, but director of a pharmacy, those are the things I lived every day for about 5 years, which is a great experience. Taught me a whole lot. And I got a lot of those things. I learned some of those, foundations from him. And as I work with some awesome people too. So definitely would include them also. But but the foundation was laid by Joe.
No, yeah, that's awesome. Yeah, yeah, no, and I'm not. I'm not surprised at all to hear you say that. Because he just sounds like a guy that he's a go getter. He's an outside the box thinker. He's not. He sounds like someone who's proactive, not reactive, and that's just those just the signs of winners. People in life, that are winning. Those are the things that they do. They don't wait for things to happen to them. They stay ahead of it. They get ahead of it, man, and they get things done. Man, man. Well, let me ask you this: what do you think about mindset? How important is mindset? To have for a pharmacist to have a successful career like you've had. Like you've got a very unique position. You've got a very unique role. You know, I'm sure your mindset had something to do with that. How important do you think mindset is in terms of a pharmacy?
Oh, mindset is everything. Like I've told people, when I set my mind on something, when it comes to, in the professional level or what have you, you have to tell me no, but I'm not gonna just tell myself no from the jump. You gotta tell me no. You gotta tell me like no, you can't. And then depending on what it is, I still might give it another shot. One of the best jobs I had, or actually one of my first jobs, I was a mentor. When I was in undergrad, I was mentoring first generation college students. It was a paid position. I'm the pay back then. I think it might have been like I don't know 5 cents per minute. I don't know how much it was. Maybe a few pennies of minimum wage, but one of the and I remember and this was back before like I mean we had cell phones, but all the social media stuff. I guess Facebook was there, but it wasn't like it is now. Like now, people like I'm having a birthday party. You never see a physical invitation. It's like a Facebook announcement or you get something in your phone. It is back when we still had like paper flyers and there'd be job boards at school. So you go and pull off a tab that has a phone number or a person's email address. And so I saw this thing and I was like, I'm a first generation college student. I have two older sisters. They both had degrees, but technically our parents, didn't have degrees. So I was like, well, I qualify for that and it would be cool. I've always enjoyed mentoring people. And so I went to the flyer and young HJ reads the flyer and it was probably like a week after the deadline had passed. But the flyers, once again, this is back when it was paper flyers. So I was like, you know what? Yank the paper down, got the lady's email address, went back to my dorm room, sent an email. I was like, hey, my name is HJ. And I know that it was a week past the deadline. I just saw the flyer letting you know that here's my resume, which it may have been 3 sentences at that time, thinking back to how long ago it was. Here's my resume. And basically, I kind of said, like, hit me up, holla at your boy if somebody doesn't work out. Because I was like, it's done, I'm like, but I tried. And so tell me why I think the following week I get a phone call at my dorm phone, which, even back then we had cell phones, but we still had dorm phones. And she was like, hey, and and then my boss Sherry, she was like, or boss at the time, and she was like, hey, she was like, I got your email. And I was like, what email? And then she explained who she was. I was like, oh, that email I sent. So long story short, she calls me in for an interview, got hired on the spot. She was like, what happened? Somebody quit. And she was like, I actually had several people who like, I interviewed and talked to. And she said, and I guess I could have called them. She said, but something about the boldness of you to be like, I know I'm late, but this is who I am. I know I do a good job. And basically, if you hit me up, if someone quits, you need someone on the spot, I promise you I'll show up. And I got the job and I did a job for 2 years. And to this day, she and I, when I go to clubs, we still hang out. And so that was one of the things that taught me, like, you don't have to have a normal invite to the party. Sometimes you can be like, you know what, I'm gonna just show up anyway. And those are some of the best things, yeah, just thinking about like my pharmacy journey. I was president of my pharmacy class. And during time I was in school, pharmacy class was optional. We had recorded lectures the whole time. So we had to be there for certain things, but a lot of the actual lectures, were recorded. So they did not take attendance because we had two campuses that were sharing professors. And so they had to record everything. So when I figured that out, I was like, well, I'm going to work at the lab, make some money. So I wasn't even in class a whole lot. when I would show up to class, sometimes different things, we would want extra points back on an exam or something like that. So I'll be one of the ones in mind saying, hey, well, even though the question said this, you said in your lecture on this day, it was that. And so at the end of the first year, it was time to elect class officers. My name got put in the half president. I actually was shocked because one day I actually showed up. I was like, well, okay. And so a few people were like, hey, we're so excited you're gonna run or you got nominated. And I was just like, and so finally I asked the girl, I was like, why? I said, like, why would you vote for me? Because I was like, I'm here for the important stuff, but I'm not a person that's like here in every organization. I think I was in one little club. And she looked at me and she was like, she said, you're so approachable. She was like, you're just a nice guy. And she was like, and you're always the guy that like helps us try to get points back on the exam. And I probably had like a 10% success rate. But the fact that I would try and ask professors like, hey, can we get some points back? Apparently people noticed. And so when that happened, so I ended up running for class president and I won. And then the following year, no one would even run against me. But that switch from the first to the second year, I had to sit down and talk to my boss at the lab. I was like, hey, I got this new role now. I can't work as much anymore. But I was like, but she understood, and I was just shocked that they would vote me president. But like I said, I just realized that, that those are the reasons why. So I was like, people notice when you're, trying hard, your mind stand up for what's right. Even if you fail, like I said, I didn't get too many points back, but I would try. Those are the things that made people that kind of even put my name in the running, and I was like, I was hardly even here.
No, that's just natural leadership. That's all you're telling me, man. You're a natural born leader, and that's what you were doing. You were leading, and that's something that we're not taught in pharmacy school. That's something that
Yeah.
a lot of people. Some people either have it or you don't, and some people acquire. You can also acquire that skill. But it sounds like you were kind of born with it, man. So that's awesome, man. It sounds like, and you utilize that to just kind of move your way up the pharmacy ladder, doing something that, you're practicing pharmacy in a unique setting, doing something that you really enjoy doing. And that's just awesome, man. Leadership will take you a long way. That's for sure.
Oh yeah,
For sure.
absolutely.
How important is vision and purpose? Like when somebody, like vision and purpose, like how important is that personally and professionally? Because that you've kind of said a couple of things that have kind of made me think, this guy's got some vision. This guy, the way you think outside the box, the way you're describing yourself through pharmacy school.
Yeah, well, my thing on vision is you got to see it before you see it, or you'll never see it. So you have to you have to have your mind on something. Even every move you take, even though right now, like I can just say, oh, I'm going to get in my car, and it's like, okay, you want to get in your car, but my vision is I'm going to get in my car and I'm driving, to get something to eat. That's the vision. That's the ultimate goal. So even when you take the steps, you may not speak your vision out loud, and sometimes it's not appropriate to. Sometimes you have to kind of get it together yourself. But you have to definitely have some sort of vision to get anywhere. And so vision is important. It's important to write things down. It's important to think outside the box. And this is important just to think like, what is the goal here? And so to me, vision is very important along with purpose. And I think we're all sometimes on a journey to find our purpose or rediscover our purpose. And so, because even now I've always told myself, like, my original purpose of being a pharmacist is I want to help people. But now I'm at a point now, I'm like, okay, I want to really hone this thing. Like, what is my how am I truly helping people? Like, what exactly am I doing to help people? And so I've helped people in different ways throughout the years, in different ways, but I'm working right now on really redefining that. Kind of my new role. Of course, I give my all at my job, but I have uh some more personal time as well. With the hours I work now, to kind of really like work through that and try to figure out some different things. To kind of talking about vision and purpose. I worked on my vision board recently. And I went to like an entrepreneurial conference to really like kind of try hone some of that stuff too. Just for the sake of figuring out, okay, what is my purpose here? Like, what's the point? I kind of have all these unique experiences. So now it's time to really combine them and go forth and figure out, what am I doing here? And is it enough? And how much more can I do?
Yeah, no, that's awesome. By being on this podcast, you're going to help a lot of people. There's going to be a lot of people that are going to see this, and a lot of the stuff that you said. I mean, I know a lot of people can get a lot of value out of what you said. So, thanks again, for everything that you shared. Well, hey, um, well, HJ, what can I do for you? What can I do to help you? What can I do to help you?
Man, it just the fact that you hit me up and said, "Hey, like, be a part of this." Because admittedly, I've read up on you, so now I know more about who you are. But originally, I was just like, well, hey, why not? Like I said, I'm a triaholic. And so the young when I was young, I felt a little more shy. The older I get, I'm just like, hey, whatever. But there was like a 5% of me was like, why am I doing this? Like, what's the point? The rest of me was like, boy, get on this podcast, run your mouth, you say, it's a chance to collaborate, get yourself out there, see what it's about. I have watched some of the other podcasts. I've been enjoying watching some of the other people you had on here. And so yeah, but this right here is plenty, and just keeping in contact, remembering me. Because I have a couple of things in mind I'm working on. Some entrepreneurial things that I'm going to kind of do. I say because I really a big part of me is just redefining my purpose and making sure I'm helping people the best way I can. So I'm working on. So the big thing I'm working on right now is kind of working on some advocacy things. Having seen both of my parents in the hospital over the last few years, which thankfully they're doing well today. But I realize how important it is to have an advocate, someone who kind of understands the medical setting, someone who can speak up for you, someone who can take notes, etc., and even hold you accountable in certain ways. And so that's one thing I'm really working on. Especially want to work with. I will work with anyone, but especially in your underserved communities, people of color, things like that. That's something I'm really passionate about. I've always been passionate about it. I help anyone, but I just realized there's a need for that. Um, and so that's certainly a area that I'm looking into. I think if I had to give advice to anyone, I would say just make sure, just make sure you kind of follow your heart, listen to yourself. Sometimes we're our own worst enemies. And sometimes we don't give ourselves the time when we're trying to climb these ladders and build up certain things. Sometimes you got to take a step back and listen to yourself and say like, hey, what is my heart saying? What's coming from the inside? And when we listen to that inner voice, sometimes that kind of starts to show us the directions we should go into, and help us find like what's really important to us. And so that's where I'm at too, on my current journey. And like I said, the people in substance abuse has always spoken to me. We all know someone who's been through substance abuse, or may know someone who knows someone who's been through it. And so that's super important to me right now. And it's been just a joy working in that environment and knowing I have some great people I work with every day. And we're all working together to serve that community as well. So
We need people out there like you doing what you do, man, because that's really providing a very valuable service, to those community and to society as a whole. So thank you for what you do.
thank you. Yeah, but going back to your question, well, also let's keep in touch. I like keeping
Yeah,
in touch with people,
of
checking in
course.
with folks, because
Yes, sir.
it's sometimes we can do things for each other, help each other out.
Yeah, yeah, no,
Um,
and I've got some people that I got some people in my network that think very much along the same lines that you do in terms of what you're saying. I got some people that I can hook you up with that would love to collaborate with you on projects like what you're describing.
oh, great.
Yeah. Well, how can my audience get in touch with you?
Oh, that's a good question. I mean, so you have my email, drhjhayes@gmail.com. Probably the best way, the most efficient way.
Hmm.
I'm not, I don't have a big social media presence at the moment. Nothing like that, but
Okay, but
something
you're on LinkedIn. You're on LinkedIn, right? They can
yeah,
find
I'm on
you.
LinkedIn as well. I went my government name. I think it's Harskin HJ Hayes on LinkedIn. So yeah, those are the easiest ways.
Fantastic. Well, all right. Well, HJ, before I let you go, this is the Pharmacy Rockstar podcast. I
Uh
am
huh.
a I am a musical enthusiast, rock and roll enthusiast. Before I let you go, I need you to tell me who your favorite musical rock star is.
Oh man,
When it
I
comes,
did see.
it doesn't have
I
to be rock. It can just anything music.
No, no,
Who's
I'm gonna hit you with I'm hit you with something different. So there,
oh
I actually enjoy music. I play a little piano growing up. I
oh
play
all right
trombone, and actually
all
I got
right
an old guitar in my room. I'm trying to learn how to play right
okay
now because I actually
okay
enjoy music. But my favorite, and all my friends will tell you this. My favorite is a gospel group. They're called the Clark Sisters. The harmonies, just everything about them are amazing. So that's one of my favorite groups. Some of my favorite songs is a song called "You Brought the Sunshine." And I try to live by that too. I want to be sunshine in people's lives.
Oh,
And
that's
so,
awesome,
but
man.
so those are true rock stars. And I got several honorable mentions, but the Clark sisters, there was one. Anyone who knew me in college, like knew me well, knew when I was studying. That's what got me through college. Just staying focused enough to get everything done. And that is and of course my music interest over time, those have even changed some. I mean, you have your oldies but your goodies. Sometimes you're like, oh, this is a new genre, and a lot of the new stuff now, it's different. So I'm trying I try to stay relevant in the music industry, but the Clark sisters, they're timeless. They perform from the 70s and they're on tour right now. So like they're just
that's awesome. That's so awesome.
Yeah, amazing. Yeah. So they had a Lifetime movie about them. That was cool to see like their story, on TV. And so they're amazing. I feel like I know them. I don't, but I wish I did. But yeah, it's a great group. But they are some singing sisters. So that's that's probably my all time like favorite. If anyone ever analyzed like my playlist to how many times listening to like who songs, they will probably be number one on there. So
okay, well I'm gonna check them out, man. Here after we wrap this thing up, I'm gonna go check out the Clark sisters. You Brought the Sunshine. I'm gonna check them out, see who they are.
Yeah, it's good. Yeah, definitely check them out. Check them out.
Well, HJ, thank you so much, once again for joining me on the Pharmacy Rockstar podcast. I really appreciate you being here. Folks, please look him up. Hit him up on LinkedIn, okay? And his email is on his LinkedIn profile. Please don't forget to comment on our videos. Like, subscribe. Let us know what you liked or didn't like. It's okay. You're not going to hurt our feelings. Thank you all for being here. HJ, once again, man, thanks for joining me on the Pharmacy Rockstar podcast, buddy. You rock.
Thank y'all. Thanks.